Welcome to CCK Live Under 5. I'm Kayla D'Onofrio, and today I'll be explaining 50% ratings for back pain and back conditions. Back injuries are one of the most common types of injuries for service members to experience, just due to the intense physicality associated with military service. Back injuries can occur during training or combat by vehicle accidents, falls, carrying heavy gear, and a lot more. VA rates most back conditions under the regulation 38 CFR 4.71A, which is the schedule of ratings, musculoskeletal system, and then under the general rating formula for diseases and injuries of the spine. Different diagnostic codes within this formula are used to rate different back disabilities, and the ratings issued will range from 0 to 100%, just depending on the severity of the condition. VA determines the severity of a back condition based on range of motion measurements. When issuing a rating, VA must also take into account things like functional loss and flare-ups, which really means that they have to look at the disability as a whole, not just kind of what they see on the day of the exam. They have to ask you about what your pain looks like during flare-ups, after repeated use, and not just, what your physical end point of motion is, but also at what point you experience pain and weakness and fatigability. And they have to take that into account when they're assigning a rating. So it should be a little bit more in depth than we often find that it is. For 50% ratings in particular, like I said, VA will use the general rating formula for diseases and injuries of the spine. They do have another rating criteria or rating formula for back conditions under intervertebral disc syndrome, but for the purpose of today's video, we're just going to be talking about the general rating formula for the 50% rating. This general rating formula, like I said, is used to evaluate most low back conditions, including low back pain. The rating formula, like I said, primarily is based on range of motion, which typically encompasses the range of flexion or bending and extension or straightening. The ratings range from 10, 20, 30, 40, 50, and 100%, again, just depending on the severity. Under this diagnostic code, a 50% rating is defined as unfavorable ankylosis of the entire thoracolumbar spine. In other words, a veteran with this rating experiences significant stiffening, immobility, and pain throughout the majority of their spine. As of December 1st, 2022, a single veteran with no dependents rated at 50% will receive $1,041.82 in monthly disability compensation. And veterans may be eligible to receive additional compensation if they have dependents, and as well as if they have other service-connected conditions where their combined rating would increase. So just a couple things to keep in mind in terms of what that pay rate looks like. But to learn more about how VA rates back pain and back conditions, head over to our blog at cck-law.com and check out our other videos. Also, don't forget to subscribe to our channel, and thank you so much for tuning in.